to today's Provider Education Network webinar. My name is Daisha Bonhomme. I am the Community Outreach Manager at Wellhead, Louisiana. Thank you so much for joining us today. Today's webinar will focus on making the healthy choice the easy choice healthcare facility WellSpot designation. Our speaker today is Audrey Shields, WellSpot Designation Manager with Wellhead, Louisiana. Thank you for presenting today, Audrey. We look forward to hearing from you. After today's webinar, you should have a better understanding of what our WellSpot designation program is, what is involved in a healthcare facility becoming a WellSpot, the benefits to your facility, and how we can help you through the process. And now I'll turn it over to Audrey.
Thank you, Daisha. As Daisha mentioned, I am Audrey Shields, the WellSpot Designation Manager at Wellhead, Louisiana. So I wanted to start out this presentation by talking about why we are here and even having this presentation. So according to America's Health Rankings, in 2020, Louisiana ranked 50th in the country for our overall health. How did we earn this ranking? While, Louisiana is definitely known for our great food and our festivals, we are unfortunately also very well known for our unhealthy lifestyle choices that cause our residents to lead the nation in statistics for obesity, diabetes, heart disease, and other chronic diseases. To break this down a little bit further, here's a quick snapshot of the picture of the health of our state. Louisiana has been identified as one of the states with the greatest opportunity for improvement in overall health this year. Rounding that out behind us are Mississippi, Alabama, and Arkansas for also the greatest opportunities for improvement. So what is Wellhead, Louisiana doing about this challenge across our state? So the Wellhead, Louisiana WellSpot Designation Program is one way that we are working to conquer this challenge through increasing access to resources and healthier options. The WellSpot Designation Program encourages organizations across our state to just implement small, simple changes that surround health behaviors and or benchmarks, as we like to call them, to help make the healthy choice the easy choice here in Louisiana. Wellhead has designed benchmarks for 8 specific organizational types: child care centers, colleges and universities, hospitals, healthcare facilities, restaurants, schools, work sites, and faith-based organizations. Today, we are going to cover our healthcare facility benchmark. So I'm glad that you're here, and we definitely encourage you guys to take action and implement these benchmarks within your facility. So the benchmarks that have been created for healthcare facilities are composed of evidence-based practices within the scope of the Wellhead, Louisiana team and our partners. So upon meeting wellness benchmarks, these environments are designated as WellSpots by the Louisiana Department of Health. Organizations have the opportunity to be designated as a level 1, 2, or 3 level WellSpot, depending on the number of benchmarks achieved or met within your organization. Level 1 is the highest level of WellSpot designation. All of our benchmarks include, as I said, evidence-based best practices for impacting chronic disease and obesity for both of your patients and also your employees. The Wellhead team and its partners have the knowledge to provide resources and assistance for every single one of these benchmarks that I'm going to go over. So we will now go through all of the benchmarks to give you an idea of what's included and what healthcare facilities can do to impact the health of their employees as well as their patients. Also, just to note, these benchmarks were recently updated to include a focus on chronic disease prevention and management, as well as tobacco cessation and training for providers. These benchmarks also were added to ensure a patient-centered environment that empowers patients to own and improve their own personal health care or health outcomes. So to start the benchmark discussion, all levels of designation for healthcare facility WellSpots must absolutely implement a comprehensive tobacco-free policy for their facility, as well as include patient education resources that are related to chronic disease prevention and management. In addition to these, a level 3 would include 3 more additional benchmarks to be met. That would be of your organization's choosing. A level 2 would include the same as level 3, as well as adding in screen test refer or ask advise refer implementation with an additional 5 benchmarks to be met, again, of your organization's choosing. A level 1 is the highest level of recognition, and that is where all of these 15 benchmarks that I'm about to go over would be met. And it's a great honorary thing to be recognized for a level 1 WellSpot as well. So as we go through these specific benchmarks, I encourage you to think about which benchmarks you would be best implemented at your facility, and which ones that you already may have implemented. So to continue on, in addition to the tobacco-free and providing patient education, which I did state in the last slide, healthcare facilities may also meet an additional wellness benchmarks. The first few benchmarks that you see here have the most impact on your employees, but they could also have an effect on your patients as well. These benchmarks include providing comprehensive tobacco cessation coverage within employee health plans, promotion of the Louisiana Tobacco Quit Line or another approved cessation service organization, designation as a breastfeeding friendly workplace or champion by the Louisiana Breastfeeding Coalition, implementing various stages of a worksite wellness program, which have components such as nutrition, physical activity, tobacco cessation, and mental health. So some of these items y'all may, or some of these benchmarks you guys already may have implemented in your facilities already. So you're already on a great start. Some additional benchmarks that also target employees is having at least 50% of your vending items in all of your snack and beverage machines that meet one of the approved healthy vending guidelines that are provided. Establishing healthy guidelines for vending machines ensures that employees have healthy choices when selecting their snacks and beverages in these machines. Another one is promotion of self-assessment tools for prediabetes, heart health, and heart health among employees by sending, you can send designated links through your email or even putting up just posters around your organization. Those are just really 2 easy examples to meet this benchmark. Adoption of at least 1 nutrition-based policy, which includes a healthy vending policy and or a healthy meeting policy, which within a healthy meeting policy really just encourages you as you guys meet as a group to encourage bringing, a fruit tray or maybe some granola or adding another choice as an option instead of bringing donuts or all the time. There is that balance in Louisiana that we are really trying to combat. So these next benchmarks were created with the patient in the center of the room. So because chronic diseases are the leading cause of death and disability in the United States, having a system in place to screen, test, and refer your patients to effective chronic disease prevention and management programs is a great way to improve prevention and management in your patients. Screen, test, refer is the implementation for screening, testing, and referring out for one of these chronic diseases: prediabetes, diabetes, or hypertension. So examples of this benchmark would be testing for an A1C level if you have those resources to do so in your facility, or simply just having your patients fill out a prediabetes risk test that can be in the form of a push card and or online assessment. Then they would be referred to a local national diabetes prevention program that we would help identify for you if their numbers fall within the risk range. Another example is taking blood pressure readings, which some of your facilities might already do. And then if it's in the high range, you would simply just refer a patient to any type of lifestyle change program across the state. The next benchmark is team-based care, which we think is extremely important as well as all of the others, but this one allows physicians to truly connect with their patients by involving more of the practice staff in the patient care, including handling patients' questions, calls, and messages. Utilizing a physician-led team-based care approach really does ensure that everyone in the facility is aware of the patient's important health information. Training for this can include an in-person training, attendance at a webinar, or even a conference attendance if that is available, moving forward. So training must be available to clinical as well as non-clinical staff, as we see that these are all very important pieces of this team-based care. This benchmark impacts the healthcare facility at its actual self, but can also have an overall effect on patients once it is implemented. The next is the implementation of culturally and linguistically appropriate services standards. This is a strategy toward advancing health equity, improving quality, and eliminating healthcare disparities, which again, you guys might already be doing within your facilities. But to meet this benchmarks, facilities may select from a group of strategies that we have listed on our website. But some examples of these are provision of staff training, which is sometimes referred to as cultural sensitivity or diversity training, utilization of professional medical interpreters, or utilization of telephonic interpretation services. And there are a few more on there as well. An equally important benchmark are the patient education materials, which encourage you to use educational materials as a way to offer patients self-management strategies and really empower your patient to manage their own care when it comes to chronic disease. So to meet this benchmark, your facility would simply choose 4 of the topics that are listed on your screen to educate patients by placing information or hanging posters in waiting rooms or in the lobby, even just posting information on your online patient portal, if that is something that you guys do have access to, and also having clinicians discuss self-management with patients at the time of discharge. So our next benchmark is for tobacco. The people who use tobacco need support and motivation from trusted sources, which are y'all. By asking your patients if they use tobacco, advising them to quit and referring them to cessation resources, you can truly help your patients begin their actual own quit story. Make tobacco screening and referral a standard of your care at your facility. Ask patients if they use tobacco, then you would advise them to quit and refer them to quit resources during your visits. Well-Ahead's brief tobacco intervention and facts to quit trainings, which are also part of the benchmarks, ensure healthcare providers are effectively equipped with the knowledge and skills that are needed to connect patients who use tobacco to the proper cessation resources. So brief tobacco intervention is just a quick and easy, effective approach for providers to address patient tobacco use, and it actually takes less than 3 minutes. This saves time for you and your staff and truly ensures that your patients receive the treatment that they need. Facts to Quit is a referral piece that is used where you can refer patients directly to the Louisiana Tobacco Quit line. This means that your patients no longer have to take the first step. It's where you've already had this conversation and you can refer them to the Louisiana Tobacco Quit line where someone from the quit line will contact the patient at their most convenient time. So why become a WellSpot? As you can see, our healthcare facilities are definitely positioned to have a strong and extremely positive impact on the health of both of our employees and the patients that they serve within our state of Louisiana. You, as a healthcare facility, have the opportunity to educate your employees about the importance of their healthy eating, their physical activity through a worksite wellness program. You have the ability to talk to new moms about the importance of breastfeeding, and you even have the opportunity to teach your patients how to be proactive with their health and increase your facility's focus on a patient-centered care environment, especially considering, we're 50th in the state, or 50th in the nation. This is an extremely important piece. So why does it matter? Healthier employees are happier employees. I think we all know that. We miss less work when we're happier as well and healthier, and we are also more productive. Also, their healthcare costs can go down as well. Healthier environments can also improve patient outcomes as a whole. And that's why we truly think that all of this matters so much to our state. So you may have already implemented some of these benchmarks on your own. But if we do work together to make smart, healthy choices in our workplaces, we could reduce future economic health costs by more than over $17 billion by 2023. So remember here that the goal is to make the healthy choice the easy choice across our state. So next I'm going to highlight some of our WellSpot successes. So this is WellSpot designation in action. So as of July 2021, in our state, we have a total of over 3,000 WellSpots. We have more than 10,000 initiatives that have been implemented as a direct result of our work out in the field. And for total healthcare facility WellSpots, we have about 72. So I definitely know that's a number that if we all work together, that we can definitely improve and move up. Here's an example of a designated WellSpot, the Neuromedical Center for Rehabilitation Hospital. They have a staff of about 180 employees, and it also, all of these benchmarks are for facilities that are big and small. So don't get thrown off by the 180. It could be a staff of 10 as well. They became designated as a level 3 WellSpot. They started out by adopting a tobacco-free policy, not only to create a cleaner environment for their employees, but also for their patients. They made a breastfeeding friendly environment and also created a healthy meeting policy to encourage healthy snacks coming in to the office and healthy beverages during their meeting times as well. So along with this, they also promoted the Louisiana Tobacco Quit Line and online assessments for prediabetes and heart disease. But an even more exciting part about their designation was their decision to create an employee wellness program as one of their benchmarks. They assessed their employees, finding out kind of what their desires and needs were to get healthy. So they created a calendar of events. They would send out information every month. They would have healthy competition challenges like Rethink Your Drink, and even like walking challenges and things of that nature, and events throughout the year. And just to note, other organizations in your community as well are positively affecting your patients and your employees by becoming designated as a WellSpot. You can find other WellSpots around you and opportunities to create these community clinical linkages by making connections to a community or faith-based organization while working together to improve the health of your community as a whole and support chronic disease prevention. Our team at WellAhead can truly assist you in making these connections, and you can learn all about all these types of WellSpots in your community by using our Find a WellSpot tool on our website at wellahedla.com. So how do I become a WellSpot? So now that we've talked about all of that, here is how you can actually become one. So the designation process, I know, don't get overwhelmed. It's only 15 benchmarks to be a level 1. And other than that, everything is just great after that. So it's really not that difficult. So don't be overwhelmed. It's truly easy. It's much easier than you think. So to get started, we encourage you to connect with a WellAhead regional representative that we have all across. We have a rep for every region or availability for assistance in every region. They can provide you technical assistance throughout your designation process. They are absolutely excellent at providing your facility with resources and guidance, also connecting you with subject matter experts to assist in implementing all of these benchmarks that we just discussed. The second step would be to take an assessment, to see which healthy practices, like you said, you might already be implementing in your facility. So after your assessment, you will receive an action plan for achieving additional benchmarks to go ahead and get you on the track of being designated. So once you have reached or achieved a desired amount of benchmarks, you'll take an additional assessment to just kind of show your progress and provide documentation for any of these other benchmarks that you have achieved. Once the assessment is complete and the documentation has been provided, the information is reviewed by the WellSpot designation team, us, for official designation. And after being designated, your facility will receive an official certificate from our Office of Public Health, in addition to promotional materials for your employees, as well as your patients, to really help assist and make it as easy as possible for you guys to promote that you are a WellSpot, as well as to promote to your employees how important health is at your facility. So just remember that our team is truly here to help you across our state. We will walk alongside you every step of the way as you go ahead and implement these changes within your facility.
Thank you so much, Audrey. We will now open up the floor for questions. If you have any questions, please type them in the Q&A box.
So I see the question here says, can you tell us more about how long the process takes? So the process is it's not a one size fits all. It would depend on how many items or how many benchmarks you may already have implemented, and how many you need to achieve to get to a certain level. It could take anywhere from 3 months to 6 months to a year, just depending on which level you choose and how many benchmarks that you would like to achieve. But also encouraging that we have reps that are alongside you the whole way that truly really assist you with kind of like leading you in the way, so it doesn't seem as kind of juvie, or not juvie, that's not the right word, but it doesn't seem as difficult as a task as you might think. With their assistance, they truly guide you in a very easy way with all of the resources. I don't know, does that answer your question? Perfect. And we're all here to help across the board. Anybody else have any questions?
I'm not seeing any more questions come through, Audrey.
Okay.
But for those of you who may have any additional questions, you can take note of the contact information that we have provided on the screen. And feel free to contact any of the speakers, or you can contact WellAhead directly with any questions you may have pertaining to the information from today's webinar. So again, we want to thank all of you for joining us. Please visit our website to find out more information about our programs and resources. Also, be on the lookout for our bi-weekly newsletter with updates on trainings, resources, and other opportunities. Thanks again for joining us today and for helping us move Louisiana's health forward.
Thank y'all.
Thanks, everyone.